Hey, Dan, did you know that data shows that EMS workers don't sleep enough? Wild. This week on Magic. Hey, everybody, welcome back to the Monday Afternoon Journal Club. Ed Bowder and Dan Schwester from the Overrun here. Hey, Danny. Today, we're going to talk about a study from the American Journal of Industrial Medicine. This comes out of West Virginia. Yeah. Go Mountaineers. And this is a long study. This is an industrial study. This is not a medical study. So I'll give those caveats before we really get into it. But this is a study that looked at working hours, sleep, and fatigue in the public safety sector. What I like about this is this looked at law enforcement officers, corrections officers, firefighters, wildland firefighters, and emergency medical services. And it looked at how our shifts affect our sleep, how it affects our fatigue, and then they got into how it affects our performance. So this is an industry paper, but it really kind of leans into a lot of the problems that we've talked about over these years, Dan.
Yeah, this was what they call meta-analysis. So what they did was they studied a bunch of studies and collated data and tried to see what makes sense. Very interesting. Over 3,000 articles, 3,415 articles, to be honest, out of which 202 met all the inclusion criteria. They talked about 6 common outcomes: sleep, fatigue, work performance, injury, psychosocial stress, and chronic disease. Sound familiar?
Yeah, this is all the hits.
What was really interesting that they found out, which, while it hit all the typical parameters of what you'd expect about working stress, sleep deprivation, poor sleep hygiene, health issues, only 25 of those articles had any type of idea of how to fix it. And, in this one was interesting. Firefighters, law enforcement, EMS, and wildland firefighters were the most studied. And then corrections officers bringing up the rear, which is usually EMS bringing up the rear, but I digress. It's interesting that they touch on these things. I think at this point, we know what bad sleep hygiene does. We know what shift work does. We know what going around all night posted on the street corner, going on too many calls, getting up, going to calls, getting canceled, coming back to the building for some of us. All of this stuff interferes with your sleep. It affects your fatigue. It does affect your work performance. It makes you more susceptible to injury, stress, and that leads to chronic disease.
Right.
We see that in our community on the regular. The really crazy part about this, and I know you're waiting to get off on it, is nobody's talking about how to fix it. Why?
Yeah. So what they found in this study was, of the 202 articles they discussed, only 25 discussed any mitigation strategies. That's about 10% of these data just said, so 10% was like, this is how we can do to fix it. Almost 90% of these data just say, yeah, it's a problem. Okay.
All right.
So, but what I really like about this study is, and again, in the conclusions, it has what we like. In general, more longitudinal experimental studies are needed to enrich the knowledge base on the consequences of long working hours, et cetera, et cetera. Now, where do my objections come in?
Go for it.
It talks about needing more data, right? To basically, and it talks about having the knowledge of these consequences of long working hours, poor sleep, and fatigue in the public safety sector. I submit we already have that knowledge. Right? We already kind of know. And this data came out in 2023, right? And this isn't necessarily new. This is kind of all stuff that we sort of knew before, right? But what's really great about this is in this paper, they go into detail. They separate firefighters from EMS, from wildlife firefighters, from law enforcement officers to corrections officers. So you can actually look at this and see what the studies analyze. So bringing back up the screen here, we see when they talk about EMS, we see the exposures here in these studies. Work at EMS, psychosocial stress, real-time feedback on chest compressions, work performance. Their EMS certification levels: sleep and psychosocial stress, sleep fatigue, fatigue, injury, sleep, fatigue, injury, fatigue,
Sounds
fatigue,
familiar.
fatigue. right? And it's all of these data. And this is something that is really important here. And this is something that's kind of buried in the actual paper. But when it talks about sleep, 59% of firefighters reported sleep deprivation, 23% reported insomnia symptoms. Keep in mind, 60% of EMS in the United States is fire-based. Prevalence of poor sleep quality was recorded among more than half of EMS, 64%. At LEOs, 51%. And then we talk about CEOs with post-traumatic stress disorder causing more sleep difficulty and all of those things. So simply put, this paper is showing what we've all kind of known, which is we do not sleep enough in our industries. Now, that might be a function of 24-hour shifts. There's some fire departments that are still doing 48-hour shifts. And what's important here is that sleep deprivation also can lead to poor performance at work, which I'm not here to talk about the actual administration, how management feels about it. What they mean by poor performance at work is that you can't perform the job functions of being a paramedic, of being a firefighter. So just sleep deprivation just doesn't allow you to perform at your peak, which is, we've all had that 3 a.m. call, right? There's that joke of like, how do you do med math? And it's, here's the quick and dirty 3 a.m., med math solution. We've all had those patients. And I think we kind of take it as a joke, which is perfectly fine. But the reality is that if you're not functioning well, the patient's outcome is not going to be better. This isn't new. Remley Crowe wrote about this in 2018, right? So we knew about burnout. We've known about it for 7 years. But here, we actually talk about how it affects their performance and how it might affect workplace injury among providers and psychosocial stress, which will lead to chronic disease. And what they don't go into is the mechanism of all those. If you're chronically under stress, your cortisol is going to be increased, your blood pressure is going to be up, all of those things. But this is the first time in a while I've read something that's so clearly laid out in the data that suggests we don't sleep enough, not sleeping enough, and having, and being overworked is going to reduce your performance. It's going to reduce the skills you can perform in the field, and it's going to make patients worse in the long run.
It's more than that, Ed. That 3 a.m. joke, it's on us.
Absolutely.
Our industry does not consider sleep hygiene. We still know places that absolutely forbid people sleeping on shift or getting meaningful rest. We know places that do 15, 20 dispatches a night on a night shift. We know people who work lots of overtime because they're underpaid or there's staffing. These are systemic problems. And eventually it's turning out it's killing us. We have to look at this data and start looking at how we can apply some of these approaches to how do we reduce fatigue? How do we encourage sleep hygiene? How do we encourage healthier living with our emergency services personnel? Because we're burning through them, and there's not a lot of reserves left. You're seeing less applicants for the jobs. You're seeing less people in school to be training for this. As we age up and out of the profession, who's going to take these jobs on? It's not going to be people who want to watch themselves grind themselves away, and burn the candle at both ends in the middle too, and then wonder why the candle's melted.
Yeah. Well, the other thing to look at in this particular data set is this, again, the principal authors are out of West Virginia. So it's not as if they really had any motivation to find these answers, right? If you're working in a city setting and you're an administrator, you don't want to hear that your workers need to sleep, right? Like, hey, the job is answering 20 calls a night. That's what you signed up for. And that statement becomes much more insidious. And that's kind of where a lot of the problems come from. And again,
I did it, so you have to do it.
Right, exactly. Right. It's again, that weird, training thing where like, well, back in the 90s when I started, we were doing, 90-hour weeks. And then like, okay, well, 5 years, we should have progressed. One more thing that I thought was interesting here, because again, they do isolate EMS in this data set. They also mention the research gaps, which I think is kind of damning to the EMS profession here. Research gaps include observational studies that characterize work and non-work related factors linked to sleep health and workplace fatigue. We don't have enough perspective or longitudinal studies on the relationships between exposure to diverse shift work and worker health and safety. And then we also don't have a lot of experimental studies, which is this paper's academic way of saying what I'll say plainly. We don't look at the problem so that we don't have to admit that there is one. We just don't, if we don't talk about it, We pretend like it's not there, and everyone can just go about their daily lives. It is imperative that as an industry, police, fire, corrections officers, EMS, we are at this precipice where what the job was is not what it is. Like, things obviously need to change because how often do you see ads about self-injurious behavior, or how many people, complete suicide just based off of the job that they work at? And we all just kind of like, yep, that's what happens. And that has not been acceptable to me. It is currently not acceptable to me. And now we have data that shows like, this is what we know, and we're just not doing anything to fix it. One of my fundamental arguments about changing systems or changing workplace and data set is that things come down to a matter of choice. Now that we have this data and it's been out for a year, we are choosing as an industry to not fix these things. And that drives me absolutely insane.
Yeah, absolutely. Look, this is there. It's in the corner. Nobody wants to look at it. Nobody wants to pay attention to it, because if they don't pay attention to it, they don't have to deal with it. But they're happier to deal with the secondary outcomes, which is increased sick time, increased overtime because people call out, burnout, vehicle crashes due to fatigue, medication errors, you name it. Anything can be traced back to this stuff. Suicide, mental health issues, all of this stuff is coming back to we don't have a system that helps us take care of ourselves and stay healthy, so that we have these bad things not happening or happening less, because it's easier to deal with the problems than it is to fix them with the solution.
No, and that's exactly what it is. It's if you have an issue, especially if you're in a large organization right now, again, 60% of EMS in the country is fire-based. So there's still a lot of privates and a lot of hospital-based organizations. If you work with an enormous organization, changing things and making progress is a long, long process. It's very hard to do, and that's fine. Admitting you have a problem is the first step to solving it, right? But changing a system is hard. So we end up in just kind of this gully where we know that workers don't sleep enough. We know that affects performance. We know that it reduces outcomes. We would like to improve outcomes and we would like to improve performance, but we also know that means that people need to sleep and rest more, which means that people aren't on the truck to get out in service. If you don't, as long as you're in an ambulance and you're going out and you're generating revenue for a private company, that's what people are going to want. If you're working for a fire service in a town, you might have a little bit more leeway as far as your schedules are concerned. Some fire services have sleep pay where, that 8 hours of designated sleep time, if there's a third alarm fire, you go out and you make whatever it is, triple time for doing it. A system like that might work. But in EMS, and especially in areas like ours, or God forbid, more rural areas, you're the only service. You're the only truck. So there's 25 dispatches in 12 hours that you have to get to, go get them. And when we talk about like, this isn't sustainable, the answer tends to be like, well, that's what you signed up for and that's the way it is. And that is unacceptable to me, because we're in an industry where people are just going to leave, and we already have people dying. Like we're not even to the point where, well, if we keep doing this, people are going to get sick and die. We're already dying because of this.
And just go to EMS One, look at the line of duty death updates, go to any of the fire publications, law enforcement publications. The vast majority of line of duty deaths are cardiac, or they're cardiac related. Vehicle accidents are probably up there really high too, which also points to fatigue. This is here. We're not paying attention to it.
Right. Even without the data set, let's pretend for a minute that we didn't see Allison's work in this journal club, right?
Mm-hmm.
Hey, I've got an idea. Why don't you stay awake for 24 hours, and then I'm also going to put you in a 7-ton vehicle and put you on a highway?
Great idea.
If I pitch that to someone as a non sequitur, they would think I'm absolutely out of my mind. But when we say we do it in EMS, they're like, oh, yeah, no, that makes sense.
Yeah, that fits.
And again, because we've always done it for these past, 50 years, all right, that's just the way that we have to do it. As I said, that is unacceptable to me. The data is extant. We know, like, we're killing our providers. That's what we're doing. We're killing our firefighters, our law enforcement officers, our correction officers, and our EMS workers. We are aware of it. The data is extant. And anything that we do from here is a choice. If we don't try to fix this problem, it will continue to perpetuate. People are going to die. The industry is going to get worse. We have to acknowledge this problem and we have to work to fix it. Please watch all of our content on YouTube and Spotify and on Apple Podcasts. Be sure to check all of our stuff out on EMS One News as well. This is our last Journal Club for 2024. Happy 2025. Let's see what happens next year, because what the hell? Things are going to get wild. Danny, thanks for everything this year.
Hey, you too, Ed, man. It's been great, but looking
it's been
forward
a good year.
to the, yeah, sure it has.
All right, guys, that's it for Journal Club of 2024. We will talk to you next year.